My name is Jillian, and I was diagnosed with multiple sclerosis when I was 19 years old. When I was 16, I woke up one morning with my legs tingling. It wasn't a normal tingling like when your legs fall asleep. The tingling lasted about an hour, but I didn't think it was anything serious. My next symptom happened 8 months later. I was doing some homework when my vision went blurry and it hurt whenever my eyes would move. It was really scary. I took a nap, and then when I woke up, I was fine again. The turning point when I told my mom about my symptoms was when I was 18. I was with my friends, and when I tried to get up from my chair, my legs were numb. I didn't know what to do. After that, we went to the doctors.
So as you know, we suspect that you're showing early signs and symptoms of multiple sclerosis. We've scheduled you for several diagnostic tests to make an accurate diagnosis and rule out other possible conditions that may show similar signs and symptoms. We'll be starting with a thorough medical history followed by several blood tests. Depending on those results, we'll be doing a lumbar puncture to collect cerebrospinal fluid as well as an MRI. Lastly, we may conduct an evoked potentials test. This test will record electrical signals produced by your nervous system in response to visual or electrical stimuli. It will allow us to measure how quickly the information travels down your nervous system. So we've received your test results, and based on your blood tests, we were able to rule out several infectious and inflammatory diseases. However, your cerebrospinal fluid analysis revealed abnormalities in white blood cells and antibodies that are typically associated with multiple sclerosis. As you're aware, MS is a disease in which the body's immune system attacks the protective covering surrounding the nerves of the brain and spinal cord called myelin. The myelin becomes inflamed in small patches called plaques or lesions, which can be seen on your MRI scan. So as you can see, you have a lesion right here in your superior temporal gyrus. We believe that we were able to confirm diagnosis of multiple sclerosis. We are going to do everything we can to treat and manage your symptoms and slow the progression of the disease.
Jillian was such a healthy little girl growing up. I would never have imagined that my daughter would one day be diagnosed with MS. When I first heard the news that Jillian was diagnosed with MS, all I could think about was, what could have caused this? The doctors told us the exact cause of multiple sclerosis is still unknown. However, several factors are likely involved, including immune, environmental, infection, and genetic factors. The doctors said that several genes are believed to play a role in MS, and that the risk of developing MS increases if a close relative, such as a parent or a sibling, has the disease. That's a terrifying thought for a parent. Researchers believe that MS develops because a person is born with a genetic predisposition to react to some environmental agent that, upon exposure, triggers an immune response. One environmental factor may be a lack of vitamin D. Studies have shown that people who live far from the equator are at higher risk. Reduced sun exposure is associated with living in these regions, and that would result in the body to produce less vitamin D, which is thought to have an important role in immune function. We're hopeful that research is bringing us closer to understanding the cause of MS, and that this may one day result in a cure for Jillian. In recent years, progress has been made in characterizing immune factors involved. Researchers have been able to identify which immune cells are mounting the attack, factors that cause them to attack, and sites on the attacking cells that appear to be attracted to the myelin to begin the destructive process. Viral and bacterial infections have also been considered as an underlying cause. Viruses are known to cause inflammation and the breakdown of myelin. However, none of them have been proved to trigger MS to date.
Neurons send signals through the body at great speeds, partially due to the fatty coating that surrounds the axons of these nerves called myelin sheath. This insulating coating allows action potentials to skip between the gaps in the myelin, resulting in normal signal conduction. In the case of multiple sclerosis, this normal signal conduction is disturbed. MS is defined as an autoimmune disorder. The immune system normally recognizes and fights off foreign agents in the body with protective process called inflammation. With autoimmune disorders, lymphocytes start to recognize the body's own tissues as foreign. Specifically with an MS, a type of immune cell called an inflammatory helper T cell, or Th1. Th1 enters into the CNS through the blood-brain barrier. Once there, these T cells recognize healthy myelin as foreign and start to attack. This triggers an inflammatory response, recruiting other cytokines, antibodies, and macrophages to further break the myelin sheath. Upregulation of cytokines, such as TNF-beta, IFN-gamma, and IL-2, are associated with MS. Remyelination of the affected axons can seem to temporarily improve symptoms, but the process of the demyelination leads to a buildup of scar-like plaque on the axons. These scars, or sclerosis, are produced by astrocytes and prevent oligodendrocytes from remyelinating the axons. MS is also associated with higher than normal levels of oligodendrocyte cell apoptosis, which is programmed cell death. As well as an inflammatory disorder, MS is also neurodegenerative. Myelin will continue to be attacked, and it will be more difficult to remyelinate the axons as oligodendrocytes die and scars build. These unmyelinated axons are unable to send and receive signals properly. This leads to the many neurological symptoms of MS.
After I received my MS diagnosis, I expected the worst. My doctors told me it's easy to live a relatively normal life with the right medications to treat my symptoms. My medications are mostly to slow the progression of the disease and to speed the recovery from my symptom attacks. I see a physical therapist twice a week to learn strengthening exercises and to stretch my muscles, which helps me perform daily tasks. Muscle relaxants are also a very important element to my treatment plan because they help avoid the painful muscle stiffness I sometimes experience. My team of doctors encourages me and they have supported me through this entire process, and I'm forever grateful.
Even though Jillian's treatment is making her life easier right now, there's still so much we don't know about MS, from its causes to its detection. When we first found out about Jillian's diagnosis, I researched alternate treatment options in any free moment that I had so that I could find a better option for Jillian, other than the current medication on the market, which is interferon beta 1A, which requires injections 1 to 3 times a week. Turns out there's not a whole lot out there. Current research is focusing on better detection techniques to allow for earlier intervention to slow the progress of the disease. Some of the methods involve the use of anti-myelin antibodies, positron emission tomography or PET scans, and different applications of MRI such as functional MRI, diffusion tensor imaging, and magnetization transfer. The development of these technologies and earlier detection would definitely have a major impact in the field, and it's definitely something I wish would have been available for Jillian. The research that I am most excited about, however, is the use of stem cell therapy in the treatment of MS. A group of researchers at Northwestern University recently found that 50% of MS patients who underwent autologous hematopoietic stem cell transplantation, or HCST for short, improved physically. HCST involves harvesting the patient's own stem cells from their blood and injecting them back into the patient. Those 50% of patients also showed improved cognitive function and quality of life. MRIs even showed reduced brain lesions. HCST therapy would be perfect for Jillian, since it has worked optimally for people in the earlier stages of the disease, or the newly diagnosed. I hope that this treatment becomes available soon to more people, especially Jillian. Living with MS isn't easy. There have been highs, there have been lows, but we're learning to cope with it as a family.
My family, and my mom in particular, have been so good to me, and I don't know how I would have made it without them. They've supported me through it all, and I'm forever grateful. The doctors and treatment that I have received have been amazing and improved my quality of life so much, but there's still so much that we don't know about MS, and so much more to discover about the disease.
We still don't have a cure, and every day more people around the world are diagnosed with MS. It's time that we take a stand and finally defeat the disease. For more information about how you can help, please visit the Multiple Sclerosis Society of Canada. And remember to always
Keep smiling.